So in this video we are going to see about fibula, one of the bone of the leg situated in the lateral aspect. It is very difficult to identify the side of this bone, but compared to other bones, this bone have very less amount of external features. Okay, the word fibula means safety pin. So once if you see this bone connected with tibia, you can see like somewhat like a pin like appearance, safety pin like appearance. So they name this bone as a fibula. Fibula is a Latin word. In Greek, safety pin is known as peroneus. So this bone we can also known as peroneal bone. If you study about the lateral compartment of leg, there are two muscles. One is peroneus longus, peroneus brevis. So the word peroneus means fibula. Then the sciatic nerve terminate into common peroneal nerve and tibial nerve. So that common peroneal nerve is related to the fibula, especially the lateral aspect of the fibula near the neck of the fibula. So it is known as common peroneal nerve. Any injury happen at the level of the neck of the fibula, it leads to damage of that nerve. Once common peroneal nerve get injured, it will leads to a condition called foot drop. Okay, so now we will try to identify the side of this bone. For identifying the side of the bone, if you notice, the both side of the bone are bulged. It not have any condyle. Where to identify the head, where to identify the neck, is not possible. But two things you have to remember. One is a triangular facet. If you identify a triangular facet in one end, that end will be the lower end, and behind this triangular facet there will be a elevation. That elevation will be the lateral malleolus. Between this triangular facet and the elevation there will be a small depression. This depression will be malleolar fossa. These three features will define the lower end. Once you identify the lower end, you identify the position of the bone. This is lower end and this is upper end. Upper end will have a circular facet. In this bone it is damaged. Upper end will have small circular facet in the upper aspect. So lower end will have malleolar fossa, triangular facet and lateral malleolus. Now we have to identify the side. For identification of the side, this malleolar fossa should go posteriorly and this malleolus should present laterally. So once you rotate the bone and the fossa went posteriorly and fossa is present posteriorly and the malleolus come little anteriorly. Now I am holding that bone in a correct position. It is a left side bone. Okay, so these three things are very important to identify the side. Then we came on the shaft. Shaft will have three borders and three surface. So once you keep the bone in position, you can appreciate a sharp border. That border will be the medial border or intraosseous border, which give attachment to the intraosseous ligament between the tibia and fibula. Then anterior border and posterior border. In between this border we will have three surfaces: anterior surface, medial surface and lateral surface. These surfaces have some important muscle attachment. Anterior surface will have muscle attachment continuous with tibia and intraosseous membrane, like extensor digitorum, extensor hallucis longus, peroneus territoris, that are present in the anterior surface. In the lateral surface, peroneus longus, peroneus brevis. In the posterior aspect, flexor digitorum, flexor hallucis, tibialis posteriorlis. These muscles, these all muscles have also attachment with the intraosseous membrane and the tibia. Then what is the importance of this bone? This bone upper end will be connected with tibia, lower end will form the lateral boundary of the angle joint. So this bone not form any attachment with femur, it not have any relation with knee joint, and it is the thinnest bone, it not bear any weight. The important aspect of the bone only lies in the lower end. This lower end have a triangular facet and malleolar process. This malleolus and this triangular facet give attachment to few ligaments. That ligaments are helps in the stability of angle joint. like anterior fibulolateral ligament, transverse fibulolateral ligament, and capsule of angle joint. These three are the major ligaments which are attached to this malleolus and near the triangular facet. This all play important role in the stability of the bone. In clinically, this bone, once a person put his leg in a hole while walking, so there is more chance the lateral malleolus of this bone may get damaged. Compared to other bones, this bone not have any important features, only malleolus, malleolar fossa and triangular facet. These three things you have to remember to identify the site. And this bone they used for grafting. If any bone during surgery, they will take a piece of this bone to graft that area. That all about the clinical anatomy of this bone. Thank you.